Hi there, this is Susan Houston with ECU Nursing 8271, here to discuss Health Information Exchange. Health Information Exchange, or HIE, is a safe way to store patient information in a secure system that allows other authorized parties like primary care, emergency room physicians, pharmacists to view the secure information for decision-making efforts as it applies to the intended individual or entity. It allows healthcare professionals and patients secured access and ability to share medical information electronically. HIE is accessible through secure internet connections. E leads to improved quality of care, enhanced patient safety, decreased referral times, enriched information security, improved health outcomes, and reduced overall patient care and system costs. There are three forms of health information exchange. Directed exchange would be sending and receiving secure electronic record information between providers. Referring providers would be able to see recent notes, labs, studies, and x-rays, decreasing referral time, improving patient visit, and decreasing unnecessary labs. Query-based exchange, a provider would be able to find or request information on a patient from another healthcare source. For example, an ER visit, the provider would be able to see meds, allergies, problem list, and recent visits to other facilities. Consumer-mediated exchange, patients would be able to utilize their health records and information with other providers and be able to update medical records, review their labs, and monitor their health. At the federal and state level, laws, policies, standards, and guidelines of care have been implemented with the intent to develop and expand health information technology, ensuring privacy, safety, and security of electronic health records. At the federal level, in 1996, the Health Insurance Portability and Accountability Act, HIPAA, was passed as a law to protect health information to help decrease fraud and abuse, regulate health information standards, national standards for administration and protection of individuals' health information, and how the rules apply to health organizations or users of health information. In 2009, the Health Information Technology of Economics and Clinical Health Act, HITECH, law was passed. HITECH supported health information exchange systems nationwide to expand the electronic movement and utilization of health information among providers. Each state had their own timeline and agenda to implement HIE. 2009, federal funding for Health Information Technology, HIT, for Medicaid Electronic Health Record Incentive Program authorized by the American Recovery and Reinvestment Act, which allowed states to request health information technology administrative funding to aid with expansion of health information exchange, which leads to stimulated economic growth and improved health care delivery. This led to the Office of National Coordinator for Health Information forming two committees for health information technology, policy, and standards. At the state level, in 2015, a law was passed creating North Carolina Health Information Exchange Authority, which oversees and administers North Carolina Health Information Exchange Network, housed in the North Carolina Department of Information Technology's Government Data Analytics Center. Carolina HIE authority requirements are for Medicaid services providers, physicians, PAs, nurse practitioners need to have electronic health records connected by June 2018. All other Medicaid providers and state-funded services need to connect by June 2019. Prepaid health plans needed to be connected based on contracts with the North Carolina Division of Health Benefits. Local management entities, managed care organizations needed to submit claims by June 2020. Dentists and ambulatory surgical centers needed to submit clinical and demographic data by June 2021, and pharmacies needed to submit claims data pertaining to the state by June 2021. 2016, North Carolina Health Information Exchange Authority changed its name to North Carolina Health Connects, powering healthcare outcomes with guiding principles that geared around the patient-centered model, transparency, looking at collaboration between organizations, being a neutral party holding data, showing accountability and efficiency, having supportive, informative, innovative approaches with responsible steward for data. Benefits of NC Health Connects include public health registries, provider directories, direct secure messaging, training materials, secure connections throughout North Carolina, allowing connections to hundreds of practices, health departments, federally qualified health centers, rural clinics and hospitals, to allow access and sharing health information with comprehensive patient records to improve care, decrease redundancy, improve efficiency and effectiveness in diagnosis and treatment for quality improved outcomes. Recommendations to advance implementation in North Carolina are buy-in from providers and patients and organizational budgeting strategies. Providers need to accept that the HIE is upon us and not going anywhere, much like electronic health records and a system that helped change the way patient encounters are documented. Providers are at the forefront of engaging patients in care and participation in HIT. Through encouragement, guidance, and recommendations, they may be the key to buy-in for patients. From the patient standpoint, the process of health information exchange, the patient's at the center of the hub. The information is geared to assisting, helping, and streamlining their care. Patients have the opportunity to be in charge of their personal health information and should take it on. Patient education, transparency, and coaching at healthcare offices would benefit patients' knowledge and understanding of HIE. This may help increase patient participation and buy-in. Organizational budgeting strategies. Facilities and organizations would need to secure funding to help build and develop connections with the Unified Health Information Exchange. They may need to increase or add to fiscal year budgeting or look to national funding as a resource. This would ensure funds to work towards the efficient HIT policies with best practices and solutions to implementation, connectivity, continuity, maintenance, and growth. Funding would need to support marketing, training, department development, staff, and patient education. Here are my resources for the slide presentation. Thank you for your time.